Type 0. The invisible beginning. You don't notice it. Not at first. A paper cut, a nick from a razor, a drop runs like a whisper across your skin. This is type 0 blood loss, the ghost that bleeds without a scream. No panic, no lightheadedness, no pulse quickens, no alarm sound. The vessel ruptures, but the body doesn't flinch. You lose less than 10% of your blood, maybe 300 to 400 milliliters, like spilling a glass of water. Your heart doesn't care. Your brain stays silent. Your skin remains pink. Your breath steady. This is the lie of safety, where trauma begins with silence, where the wound seems small, but inside, the war has started. Example, you slice your hand on a can lid. The sting is sharp but shallow. You rinse it underwater, tape it up, and carry on. The world remains the same for now. Type 1, the first red warning. Now the body leans in. Now it listens. Now it knows. This is type 1 blood loss. Subtle, but shifting. You've lost 15% of your blood. That's 750 milliliters, more than a bottle of soda. Still, the pulse holds. Still, you might smile and say, "I'm fine." But your body whispers, "No, you're not." The skin may pale. The fingertips cool. A yawn escapes your lips. Not from boredom, but from beginning collapse. Your heart beats a little faster. Your vessels shrink tighter. The blood you've lost is being missed, and your body is compensating in secret. You won't faint, not yet, but you'll feel the wind shift inside you. A storm assembling under your skin. Example, a fall from a bike leaves your leg gashed. Blood soaks through your jeans. You sit up, dizzy for a moment, brushing it off, but walking feels harder than it should. Type 2, the quiet collapse. Now it turns. Now the veil lifts. Type 2. Blood loss is where survival becomes a conversation, and your body speaks with urgency. You've lost 15 to 30% of your blood, up to 1.5 liters, a family-sized bottle, now missing from your veins. The heart races, 100 beats per minute or more. The skin turns cool, the hands clammy. Breath shortens, not from running, but from drowning in absence. Oxygen fails to arrive. Organs begin to ration. Your mind flickers like a light bulb nearing its end. You are awake, but you feel distant. Your vision tunnels. Your ears hum with the static of survival. Now you're not just bleeding. Now you are losing time. Example, a kitchen accident slices deep into your forearm. You try to drive to the ER, but miss a red light. Your hand trembles on the wheel. You feel your soul moving backwards. Type 3, the edge of life. There is no pretending now. This is not pain. This is preservation. Type 3 blood loss means over 30% is gone. 2 liters or more. You are no longer human in routine. You are human in crisis. Your heart rate rockets. Your blood pressure crashes. Sweat pours as your body cries for help in chemical language. Your lips turn gray. Your consciousness flickers like a dying signal. You say words but don't finish sentences. Thoughts tangle like thread unraveling. The body pulls blood inward, away from fingers, from skin, from hope. It feeds the brain, the lungs, the heart, and nothing else. Without help, you are dying. Not metaphorically, mathematically. Example, a car crash. You're pinned. You see your leg open, bleeding freely. Paramedics arrive. You smile at them, then your head drops. Type 4, the final breach. This is the tipping point, the threshold between biology and memory. Type 4, blood loss is catastrophic. Over 40% is lost, more than 2.5 liters. You are beyond pale. Your skin is wax. Your eyes, unfocused, stare past light and faces. Blood pressure is near zero. Your pulse, thready, or absent. Breathing becomes a gasp, shallow, desperate, collapsing inward. You are in hypovolemic shock, the medical term for your fading. Cells begin to die. Organs follow. The brain dims. If no one intervenes, you die in minutes. Not because you were weak, but because no system can function when its river runs dry. Example, a soldier hit by shrapnel, waiting for evacuation. He murmurs his daughter's name, then falls silent. No more bleeding. There's no more blood left to lose. Type 5, the beyond and back. It's rare, but real. Type 5. Blood loss is not just survival against odds. It is revival from death. This is the space after total shutdown, where the heart has stopped, where the lungs no longer rise, and yet someone fights for you. Tourniquets, 4 lines, chest compressions. The clock ticks backward, then forward again. You awaken not in joy, but confusion, because death let you go, and life somehow still held on. You are not whole. You are recovering from a war you don't remember, but you are breathing, and that is everything. Example, a patient coded twice on the table, doctors brought them back. Now they stare at the ceiling in silence, remembering nothing, but knowing they left something behind. Type 6, surgical silence. This isn't battlefield blood. This isn't trauma on asphalt. This is the kind of blood loss we allow in cold rooms, under bright lights, with masks and metal. Type 6 blood loss is controlled, calculated, yet still dangerous. Surgeons might remove up to 50% of your blood during complex procedures. A liver transplant, open heart repair, major trauma reconstructions, your body lies still, drained by necessity, but kept alive by machines, by tubes, by timing. The difference? Here, you are surrounded by guardians. You lose blood, but you are given time. You are drained, but you are also filled. Packed red cells, plasma, saline, an artificial tide matching each ebb with flow. Example, a patient undergoing a 12-hour liver surgery. The surgeons clamp vessels, pump in transfusions, suction out the damage. Liters of blood lost, but the heartbeat continues, cradled in hands that know how much you can lose and still come back. Type 7, delayed death. You thought it was over. You walked away, bandaged, stable, smiling even, but type 7, blood loss waits. It hides. This is internal bleeding, the quiet assassin, a ruptured spleen, a pelvic fracture, a slow bleed in the gut or brain, and your body doesn't know until it's almost too late. Hours after the trauma, your pressure drops, your stomach swells, your skin sweats, your breath shallows, then the panic rises, and no one knows why until it's almost gone. This is a silent hemorrhage, and it kills not with violence, but with time. Example, a man falls from a ladder. He gets up, brushes it off. 6 hours later, he collapses in his home. The bleeding never stopped, it just never showed. Type 8. The child's drain. Smaller bodies bleed faster. Smaller hearts have fewer beats to spare. Type 8 blood loss is what happens when adult calculations fail. A child may only hold 1 to 1.5 liters of blood in total. That's it. So losing just 250 milliliters, a cup, can send them spiraling. They crash harder. They go pale faster. They stop speaking, stop crying, stop reacting. Pediatric blood loss is a sprint, not a marathon. And in the wrong hands, that sprint ends at the edge. Example, a toddler is bitten by a dog. The wound bleeds. The parents panic over stitches, not realizing the child's heart is slowing. There isn't enough blood left to cry. Type 9, frozen blood loss. Now step where nature breaks the rules. Where blood doesn't flow, it freezes. Type 9 blood loss is hypothermic hemorrhage, where extreme cold and trauma collide. In sub-zero conditions, bleeding can deceive. Wounds clot faster at first, until they don't. The cold contracts vessels, then kills them. Blood thickens. Clotting factors shut down. Organs don't just suffer from bleeding, they suffer from slush. The irony? You may be bleeding less visibly, but you're dying twice as fast. Example, a hiker falls through ice. They're pulled out, shivering, with a deep gash in their thigh. They feel fine, but their core temp drops, and they die en route to rescue, from blood that wouldn't warm and wounds that wouldn't close. Type 10. Artificial rebirth. Now enter the realm of science fiction, slowly turning real. Type 10. Blood loss isn't about loss. It's about replacement. Synthetic blood. Oxygen carriers designed in labs. Red cell substitutes that don't clot, don't carry disease, don't need typing. In trauma zones. In war fields. In ambulances that can't carry full blood banks. This could be the bridge between loss and life. We are not fully there yet, but we're close. Type 10 is the answer to centuries of bleeding out, where science says you don't need blood, you need what blood does. Example, a soldier in a desert outpost is shot. No blood is available. A medic injects a clear synthetic fluid. Oxygen returns to his brain. He lives, not by transfusion, but by technology. Type 11, death with a pulse. This is where paradox reigns, where you bleed, but no one sees blood. No wounds, no trauma, just the collapse of a body betraying itself. Type 11, Blood loss is massive internal hemorrhage in medical events, a ruptured aortic aneurysm, an ectopic pregnancy, a tumor that erodes silently through vessels. You may wake up, feel odd, and within minutes, everything fades. No battlefield. No knife, just the body's betrayal. Example, a woman in her 30s clutches her side in pain. She's rushed to the hospital. Ultrasound reveals liters of blood pooled inside. She coded in the OR. Her blood left her, but never touched air. Type 12, the last red memory. This final type is philosophical. Emotional. The moment where blood loss becomes not just biology, but legacy. Here lies the trauma of the survivors. The blood spilled on battlefields, on hospital beds, on streets, in protests, in silent bedrooms. Type 12 blood loss is about those we lost, not because medicine failed, but because we reached the edge of our understanding. It's the reason trauma surgeons stare at ceilings, why soldiers stare at boots instead of eyes, why some paramedics never speak of certain calls. Blood loss leaves stains we cannot clean, memories we cannot suture, scars we don't always wear on our bodies. Example, a young man donates blood regularly in honor of his brother. His brother didn't die from disease. He bled out on a dark road, waiting for help that came too late. Now the survivor carries the memory and gives, so others won't lose. You live because blood lives. You die when it leaves. But not all blood loss is visible. Not all bleeding is red. Sometimes it is white, the color of hospital tiles. Sometimes it is blue, the shade of police lights. Sometimes it is memory. And somewhere between type 0 and type 12, between drops and rivers, between seconds and eternity, is the fragile balance of life itself.